helps a great deal in our closures. Some of the patients that we have are very thin. There can be a lot of pressure exerted underneath the surgical wound from the devices we're implanting. Some of the patients are very elderly and don't have good tissue turgor to really support a good closure. In those cases, having a knot, as we did with conventional suture, sometimes creates a small area for a stitch abscess, which can be a source of infection. Sometimes just too much tension under the incision that inhibits good wound healing. And having the V-Loc device and eliminating that knot, I think really helps that edge of the incision close nicely and heal nicely. What we find is that using the V-Loc device, we get very nice approximation of the tissue on the levels we use it, and it really holds the tissue together very well. Creates a nice holding together the tissue without putting a lot of tension and a lot of strain on the tissue. So it holds the tissue well, approximates the tissue well for good healing, but doesn't damage the tissue by pulling it too tight or creating too much tension or necrosis superficially. I close my incisions in 3 layers. The deepest layer I'm not using it for, but then the 2 upper layers I am. I'm using a 3-0 for the second layer and a 4-0 for the subcuticular layer. In the surgeries that I do and the devices that I put in, these range from a single chamber pacemaker, which costs several $1,000s, to a multi-lead defibrillator, which can be up to about $30,000. In these procedures, the difference in price between V-Loc and conventional suture is really fairly small. And if we get better results in terms of wound healing, in terms of patient comfort, in terms of maybe preventing one infection down the road, which leads to having to explant that device, rehospitalize that patient, put in another device, then that difference in cost is well worth it. I'm using V-Loc for pacemaker implants, defibrillator implants, and generator replacements for both pacemakers and defibrillators. I use it for all of my device implants and replacements. I really don't see any reason not to use it. I think it gets better results for every device closure.